All right, thanks for staying with us. Close to 8 million South Africans are living with HIV, making the country the global epicenter for the disease. KwaZulu-Natal is home to most of these infections. The latest health department statistics show about 50,000 deaths from the virus annually. This is despite more than 5.5 million South Africans on anti-retroviral treatment, the largest treatment program in the world. With the rise in new infections post the COVID-19 pandemic and the burden on young women in sub-Saharan Africa, scientists, NGOs and policymakers are this week in Durban for the 11th SA AIDS conference, hoping to reignite a multi-pronged approach to fighting the virus.
There are 38.4 million people living with HIV globally. With South Africa home to the lion's share of this, AIDS scientists, policymakers, NGOs and government are regrouping post-COVID-19. Among them is Dr. Farid Abdullah from the Medical Research Council. Concerningly, during the global COVID-19 pandemic, the number of people who tested for HIV in South Africa decreased by 20%.
All the people who didn't have their treatment are now arriving at the hospitals in a much sicker state. All those people who never tested are now presenting with severe disease, whereas they would have presented with mild disease. So we have this HIV rebound phenomenon, and we actually need more money in the health services to accommodate this new need. So the rate of new patients starting anti-retroviral treatment stagnated, declined compared to previous years. And for the first time in the last 15 years, globally, there's been an increase in mortality from HIV.
Young women remain the most vulnerable to the disease, making up a third of all new infections. Research and the development of preventative interventions specifically here is a key priority. The Depaverin vaginal ring is easily insertable and replaceable after 28 days. The second game changer has been oral pre-exposure prophylaxis, or PrEP. In South Africa, this once-a-day pill is freely available at all healthcare centres. But are these preventative measures reaching enough young women fast enough?
And I would consider that to be a failure on our part, because if you look at places like London or Paris or Berlin, it's the oral pre-exposure prophylaxis which has really completely snuffed out the new infections there. They've brought their epidemics under control, and we have injectable PrEP, which we should be deploying on a much larger scale. It's quite it's quite concerning that the price of the injectable is so high that it's unaffordable to use in a country like South Africa, and we should be campaigning quite hard to bring the prices down.
Abdullah is appealing for resolve by pharmaceutical companies and government to substantially decrease the price of injectable PrEP. While approved for use in South Africa, it is currently overpriced.
We need to make a big stink about the price of injectable PrEP. And we need to get government involved to force the pharmaceutical companies to bring the prices down. We need urgency to get generic companies to start producing it. We need government to start making commitments that it will, buy sufficient quantities of injectable PrEP if the price comes down.
The struggles of civil society will no doubt be heard loudly this week. These frontline HIV warriors are struggling with funding, most notably the Treatment Action Campaign.
It's going through a difficult period now. It had to retrench a whole lot of staff because it didn't have funding. But these are the people who brought us to where we are. If it was not for the Treatment Action Campaign, over the last 20 years, who made sure that, 5 million people have treatment, and to have a situation now where the Treatment Action Campaign is underfunded, is struggling, is something that, as a HIV community, we need to step in.
Civil society voices will lead the charge with a march on Tuesday morning ahead of the official opening to the 11th SA AIDS conference in the afternoon. Minoshni Pillay, SABC News, Durban.
All right, for a preview of the 11th SA AIDS conference, we are now joined by the Executive Director of Access Chapter 2 and Chairman of the SANAC Civil Society Forum, Steve Letsike. Very warm welcome to you. It's always a pleasure to see you.
Thank you so much, and really good evening to your viewers.
Yeah, what do you make of what is being said that it does seem as though we are regressing as a country when it comes to tackling HIV and AIDS, and this conference is said to be one where they're seeking ways to continue that fight. We had seemed to be ahead, but they're looking now to continue with this fight. It does seem as though we had in some ways regressed, and I suppose one might even blame the fact that we were stuck in this epidemic for some time, so that might have been put on the back burner. I mean, what are your thoughts on all of this?
Well, I think we shouldn't be too hard on ourselves. We have seen significant successes over the last decade and also over the last 5 years. The regress is not whether we are winning in the epidemic. It's really whether we're seeing signs of defaulting, signs of challenges, and also signs of fatigue from treatment. So it's not a regress for the country that has put significant resources where, domestically, and also from, global partners that are investing in the health response. What we've also seen, is the prevention effort. Significantly seen the decline over the last few years, not so much fast in the way we want. We are also seeing that a number of people are being put on treatment, but what we want to be seeing is that viral suppression being reached, and which has been some of the worrying factor for us in the AIDS Council to say that we must reach that viral load suppression. But I think indeed there are some evolution of sign that we must be worried about.
Yeah, another worrying factor, while you are on the topic of worrying factors, what do you think is behind this upsurge of new infections? And I must say, if one thinks about it, that is rather disappointing, because one would have thought that this younger generation would have been more aware, more more sort of educated on how to protect themselves. When AIDS hit the world, one could say that people didn't know what to do back then, but now there's all these tools and resources that one would be able to use to protect themselves against HIV and AIDS. So what do you think is behind some of this upsurge that we're seeing in the new infections, obviously among the youth?
Yeah, well, indeed, we cannot just undermine the social investment. In fact, we need to put more. If you want behavior, you can't just do a once-off kind of campaign. You can't do just a once-off kind of education. Indeed, there's been more awareness raised and so forth, but you constantly have to keep the agenda on the table, visible, to remind people, because then there are competing challenges. So while we've seen the decline of incidents, but we are also seeing that it's not moving in a way that we want to see. We were supposed to reach already the 88,000 new infection per annum in 2020, and we have not done so. But also in terms of the treatment. So I think more investment must go to social science, behavior change, and going to civil society for literacy and education and awareness.
Yeah. I want to talk about the National Assembly now passing the NHI bill. And in fact, I remember some years ago, you and I were in fact on a panel where then Minister Dr. Aaron Motsoaledi spoke very passionately about what the bill at the time. Are you of the view that this was, the right move, and that this will improve the situation in the health sector? And, we were having those discussions about some of those objections that we heard back then and that we're still hearing now. But ultimately, let's talk about what your view is then, now that this bill has indeed been passed in.
Yeah. Look, our view is very much solid. We have called on the national health insurance for the longest time. We are a country that must be decisive. Indeed, yes, some aspect of the bill need to be fixed, whether it's around regulation, it's around the system of coordination. All of those things must happen. But we cannot take 10 years where we want to break the barrier, address inequalities. I think it was a good decision for the Assembly, really for a National Assembly to move with this national health bill. What we need to do as stakeholders, as sectors, we must contribute to actually help the government to shape up what regulation and framework this must look at, so that implementation must happen. But what we are clearly sure of, universal health coverage of health must be felt by everybody. People can't be disconnected because of what is in their pocket and not. And I think the government must move in that aspect that prioritizes everybody and that prioritizes access and availability.
All right, so let's then talk about, your expectations of from the 11th SAAIDS conference. They've clearly stated that they're looking at, multi-pronged approach to tackling HIV and AIDS. And one wonders, what some of those approaches would be. And I suppose talking about NHI would also be one of them. But what are really your expectations around that?
Look, my expectation is that we have not gathered, for the last 4 years because of COVID, and we come again from a public health threat. Now, reconvening, it says reflect, act, but we need to end the epidemic. But what is fortunate about this period, we are having this conversation with the fact that the Deputy President, Mr. Mashatile, launched the NSP 2023 to 2028, and which actually speaks about maximizing equitable and equal access to services and solutions. And here, different sectors, stakeholders, scientists are coming together to say, we can do it. Let's actually prioritize. Let's make sure everybody is on board and leverage on the resources that are here. I think HIV response has been teaching us how to do better and work better. TB response have done so. So I believe that we must actually utilize this kind of reignition as a way that really puts resources where our mouth is, but going back to people. For me, it's about people. Don't center anything except for people and access to health. That is how we live throughout our constitution.
All right. Steve Letsike, it's always a pleasure as usual. Thank you so much for giving us your time here on SABC News. We appreciate it very much.